My name is James Wolffsohn. I am a professor and Dean of Optometry at Aston University in Birmingham in the UK. I'm a trained optometrist and I now teach optometrists and do research into eye conditions.
So there's a variety of different genes and eye conditions. So why do people have to get the eye test done within 6 to 12 months?
So it's really important that we have our eyes tested regularly. So there are some things that can go wrong with our eyes that you don't necessarily have symptoms, you don't feel anything. So a particular one is called glaucoma, where the pressure in the eye increases and will damage the receptors. If you like the chip at the back of your digital camera, it would damage that. Causing you to lose vision, and we don't notice that until quite a lot of our vision has already gone. Typically, we would recommend a sight test every couple of years, but there are particular circumstances. For example, a child whose refractive error, their prescription is changing rapidly, then it might be that we need to see them every 6 months. If you're a contact lens wearer, we tend to check on you more often, just to make sure that everything is working really well. But that will depend on the type of lenses that you wear.
So how do you explain the process of optometry to someone who is going to have that first eye examination, or if they're feeling nervous?
Sure. So essentially, when you go to the optometrist, they'll sit you down and they'll talk to you initially. And what they're interested in is whether you're feeling any discomfort from your eyes, how you found your vision, and a little bit about your sort of background, how you use your eyes. Do you do a lot of work on computer screens, for example? So we find out that information initially. We're then going to see how the eyes work. So we'll measure your visual acuity, so how small a letter you can see on a chart. And then in terms of the refraction, so working out whether they're lenses that we need to use to improve your vision. We can do that either with a device that comes down in front of your eyes where we can swap lenses, or we put a frame, a little bit like a glasses frame on, where we can put different lenses in to work out the optimal prescription for you. Now, if you're young, then you've got a natural ability to focus. So what we concentrate is on optimizing your distance vision, and then your eyes themselves can cope with objects held at closer different distances. By about the age of 40, 45, we lose that natural ability to focus. So at that point, what we have to do is also check what distances you like to use at near, and have a different set of lenses for those. And those can all be built into the same pair of spectacles or contact lenses to give multiple distances that you can see, or you can have glasses, for example, for distance and another pair for near. But probably the most important part of the sight test is actually checking the health of your eyes. So this is where we'll look at the front of the eye, your lids, your lashes, your tear film, and your cornea. That's the window of the eye, the clear part that light needs to go through. But we also have instruments that can look at the back of your eye. We can now take really nice photographs of the back of your eye. That actually allows us to look at the blood vessels there, and part of your brain, because your brain extends all the way into what we call the optic nerve. So the nerve that comes through to the back of the eye tells us a bit about how your brain is functioning. So there are conditions that affect the brain that we can actually see through your eyes. And because we can see your blood vessels, it helps us detect things like diabetes. So diabetes affects your blood vessels. We can see that in the eye. Nowhere else in the body can you see your blood vessels directly. So the eye is really a window to your general health as well. And we can see that through your eyes. So it shouldn't be a scary examination. It's all very simple what we do. Some of the lights are quite bright, and we'll talk to you about those. But in general, that's what an eye examination involves. We check that the two eyes work well together. And if everything's all good and you don't need a prescription, then as I say, we'd normally see you 2 years later.
How do you see the future of optometry in the next 10 years, let's say then?
So there's some big challenges on our eyes from our lifestyle. Our lifestyle now is far more related to digital devices, lots of close work, lots of very fine print that we're reading. And that can lead to dry eyes. So it can affect your tear film, and that can be really quite uncomfortable for people that develop dry eyes. Dry eye affects 1 in 3 adults and about 1 in 5 children. So there are lots of people who their eyes become uncomfortable, particularly, for example, at the end of the day. And so it's really important for the future that we manage those patients, make sure that they're the glands that produce the tears and the way that those tears get onto the surface of your eyes is optimized, and we keep the eyes healthy. A little bit like when you go to the dentist, not only do they scrub your teeth really nicely and make them feel good, but you have a responsibility to brush your teeth every day, maybe to floss. So again, that what do we need to do as individuals to keep our eyes healthy in between appointments? The other big area of change is short-sightedness. So in countries like Asia, if you're in your sort of 20s, you've got a very high chance of being short-sighted, into the 90%. And so what we've seen is that because of our environment now, there's lots of close work, lots of education, actually the eye grows too much. So when we're born, we have quite a short eye. And as we age, just in those early few years, our eye extends to match the light input into our eye. But what seems to be happening is that the stopping mechanism is no longer working and the eye continues to grow, and that's short-sightedness. Now, of course, we can correct that with glasses or spectacles, but the problem is that because the eye has grown too much, it's stretched the tissue. And if you stretch tissue, it can damage the very fine receptors in it. So we now have mechanisms to try and slow down that eye growth for people that it's going too far, to stop them being as short-sighted, and also then to reduce their risk of visual impairment, also poor vision later in life. So those are really the big challenges at the moment. So if you have children, it's really important that you get them checked, even from age 6, so we can see whether the mechanism is working correctly, or whether they are going short-sighted. And if they are, that we get them into a treatment as soon as possible to make sure that we minimize that stretch of the eye, which is useful for them because they will have less strong glasses, but also, as I say, it reduces that risk of visual impairment later in life.
What are the challenges facing us um, in this age of technology then?
So I think that sort of talks to my last question. So
Yeah.
technology, because we've changed our visual environment and the eye is very clever and adjusts to our visual environment, actually we've broken down some of the natural mechanisms to have an eye that's perfectly aligned for distance vision. So when we're outside, we have lots of low contrast items that we're looking at. It's nice and bright, and the eye uses that as its mechanism to optimize its length. If we're indoors all the time on screens, then that mechanism is disrupted, and that causes problems in the long term for our eyes. So technology is challenging our eyes in terms of how they develop.
How early should the children have their eyes examined?
So ideally from at least age 6, they should have them examined, and they'll probably have them relatively frequently examined at that age. Now, it's good in the UK because the NHS pays for those sight tests. So you can go to any of your optometrists on the high street, and there's a voucher system that pays for your child to have a sight test. And again, if they need spectacles or contact lenses, again, there's a government contribution towards that.
So you said that you're gonna check your eyes regularly. So what if someone was getting dried eyes? What's the process of that? So like I sometimes get dried eyes, and if I'm rubbing it or if I'm trying to put water on it, should I put eye drops in straight away, or what's the process of the dry eyes of getting rid of it? Is it watching too much TV, or is it just being on the go all day? What's the process?
If you are getting dry eyes, I would encourage you to go and see your optometrist, and they can do some tests within the normal sight test to determine whether that's going to be a problem for you. There are specialist dry eye centres that can then have a look at your tear film in more detail. The tear film is less than 1/10 of the thickness of a human hair, so needs some real specialist equipment to have a look at it in detail. And once we understand what's driving your dry eye, it's different for different people, then we can modify the treatment for that. In the most cases, that would be something like an artificial tear that you can get at the pharmacist, but there are many different varieties of artificial tears, so it's about choosing the right ones for you. We also have some glands in our eyelids that produce an oil that actually protects our tear film. And those glands can easily get blocked. In fact, they can get damaged and are, we would think, unrepairable after that. So again, that's something that we can look at to see the quality, the structure of those glands, and make sure that they're working optimally for an individual.
Because I play blind sports, so when you're trying to get the sight test on, what's the process of the sight test, and also the acuity of how do you know that which person is registered totally blind or partially sighted or fully sighted with 20/20 vision?
Okay, so as part of the sight test, we measure your vision, what we call visual acuity. And you'll probably have seen these charts. They have them on the back of the door at the GP as well. So there are a series of letters that get smaller as you go down the chart. And so what we ask you to do is to read down as far as you go. That tells us what your vision is at the moment. We can test your vision through a tiny little hole, which tells us what the best vision that you're probably going to get. And then with lenses, we can optimize your prescription to make sure that we can see how far you get down. Now, in some cases, if there's been eye disease, then your vision won't go all the way down to the bottom of the chart. And it may be that that's a permanent damage, so we can't do any more. And that's what we then call visual impairment. Blindness is an interesting term because most people, when they hear the word blind, they think that you don't see any light at all. But the reality is, if someone is registered blind, unless they've been blind from birth, quite a lot of those people will be able to see some vision, but it may be very blurry. It may be that they have patches of vision. So there are different definitions then of different tests that we can do to determine whether someone is legally blind. And if someone is visually impaired or blind, there are specialist services for them to make the best use of their remaining sight. And they're also entitled to some special government benefits to help them adapt their environment so that they can engage in the world fully.
Should people consider wearing contact lenses, and why should they wear contact lenses?
So contact lenses is a very good option for many people. In your cupboard, you have multiple different pairs of shoes because you're not going to wear your best parting shoes when you're out for a walk in the park. And it's a bit like that when it comes to glasses and contact lenses. Glasses are nice, they're general, very fashionable, but they're heavy on your face. They can steam up, so they've got some disadvantages as well. So contact lenses gets rid of that. Some people are a little bit afraid of putting something on the surface of their eye, but once you learn how to do it, it's very simple. They can give you excellent vision. They are now incredibly comfortable on your eyes, particularly the more advanced ones. They can correct if you have astigmatism, so your eye is more like a rugby ball than a football, and they can even correct for multiple distances. So if you are older and need reading glasses, for example, you can have contact lenses that do that automatically for you. So they are a very good option for a lot of people to give them an alternative. Many people only wear them 1-2 days a week, when they're out, or they like them in the work environment because it frees them up from wearing glasses. But it gives you more options with how you see more more ways to interact with the world. So I think that they are a really good option for people to try.
When people are getting their laser treatment done or the examined if they want to get laser treatment done or lens in their eyes so they don't want to stop wearing glasses, what's the process of that? And do you think it's good to get a laser treatment done, or should you just keep the amount of eyesight you've got?
So laser treatment, this is where they essentially take the cornea, that window of the eye, and they cut into it the shape of a lens, all very finely done with lasers. They are very accurate nowadays and work very well. And for a lot of people, that is a freedom from the prescription that they've had to wear. It's really important that we check the eyes very carefully first, particularly if you have dry eyes, the laser can make it worse. So we've got to make sure that your eye is in optimum shape before you do that surgery. And generally, the surgery only does one distance. So, for example, it would give you very good distance vision. But as you get older, you'll still need then a pair of reading glasses. So, yes, absolutely a viable option. Now, you talked also about putting a lens in your eye. So when you have cataracts later in life, and we'll all get cataracts if we live long enough, then they take out the lens that's naturally in your eye. You can't see it. It's actually behind the iris, the coloured part of the eye, and they put in an artificial lens. Those were actually invented in the UK by Harold Ridley and give you exceptional sight. We can adjust those so they give you really good distance vision. So even if you've worn a prescription during your life, you've been long or short-sighted, we can actually get rid of that when we do your cataract surgery. And again, with those lenses nowadays, we can extend your depth of focus. So we can allow you to see reasonably well at near as well as distance without the use of glasses or contact lenses. They will do them before you have cataract, so you can just replace your lens. That's rarer to do and is a private surgery, whereas for cataracts, they are mainly done on the NHS. But on the NHS, they will only do the single optic lens, so just for one distance. If you want the ones that do multiple distances, that you have to do privately.
Are the eyes the window to our general health?
Yes, absolutely. So as I was saying before, we can see the blood vessels. So it's the only place we can see the blood vessels of your body without actually digging into your body. So we can understand things like diabetes. We can see part of your brain, the brain stem. The optic nerve comes right through to the back of the eye. So if there's pressure in the brain, for example, we can see swelling of that space. By doing visual field, so looking at what you can see to the side of your eyes, we can determine whether there's been damage to the pathway in the brain, because the brain that processes vision is right at the back of the head. And so the wiring that goes, if it's been damaged, we can tell which area of the brain has been damaged. Let's say if you were in a road traffic accident. They're also now looking at how we can detect things like Alzheimer's disease through looking at the back of your eye. And then in the window, the cornea, although it looks clear to us, there are small nerves. And again, so we can determine how those nerves are damaged in diseases like diabetes by using specialist equipment that can image those. So the eye is actually a very powerful part of the body where we can detect a lot of systemic disease, a lot of general disease, because of the influence it has on things like your blood vessels and your nerves.
I have RP with tunnel vision and Lawrence-Moon-Beaton syndrome, but how would you know if someone had like Beetle-Bartle syndrome or any other genes or any kind of disability with their eyes or any condition? How would they find that out?
So in terms of what we're looking at, obviously we're looking at the back of the eye, the retina and the cornea at the front of the eye and the blood vessels. So partly it's through talking with the patient, their history and symptoms. We observe the patient. Sometimes there are physical signs that help us to determine what disease that they might have, and then we look in the eye. And we work with other health professionals as well. So in a lot of these conditions, systemic conditions, they have multiple things that they can affect. And so we might be looking at the eye part, another person might be looking at the effect on an internal body organ. So that combination between professionals to work out how your particular disease is affecting you and how do we optimally manage the various parts of that.
What best advice would you give, James, to anyone that's low on confidence, or if they need motivated, or if they're in the anxiety mode and like very shy or afraid of expanding or telling in what condition they have of their disability, or if they've got any problems with eyes?
So I'd strongly encourage everybody to have regular eye tests. It's really important that we keep our health, and particularly with your eyes, if you lost them, you would be very stuck. So it's really important that we look after our eyes. Most people have a regular dental check. That's far more scary to me because of the drilling and other things they can do. It's not like that with eyes. So as I say, it's largely about talking with the optometrist, them shining some lights into your eyes. If you find them uncomfortable, you can say that and they can turn them down. So yes, it's really a combination of those things that allow us to check that your eyes are healthy. And then we will show you some charts and ask you to read down. We'll put some lenses in front of your eyes and see whether you can see things better with one lens or another lens. And they're trained, optometrists are highly trained to have those conversations with you. Actually, if there is something that you need to know about, it's much better that you pick it up sooner rather than later. You don't want any permanent damage to be done. And again, the optometrist is trained to have those conversations with you. But for the vast majority of people, they have very healthy eyes. As I say, dry eye is becoming more common. But again, it's just acknowledging that and work out what works best for you. Hopefully not just to reduce your symptoms, but also to protect the eyes from any future damage. And if you've got some refractive errors, such as short-sightedness, again, it's good that we correct that so you get really good vision. We know if children have a refractive error that is not corrected, it impacts their schooling. So again, if we want the best for our children, it's really important that we get them checked regularly. And that will sort of help them. And also by having those early sight tests, hopefully children will get familiar with the process. It won't seem scary to them. And we can then manage their health in the long term.
What's the plans going forward, James, with this, and what's your plans?
So in terms of the future, so new instrumentation is being developed all the time for better imaging of eyes. In the future, I suspect a lot of it will be more remote. So for example, with your smartphone, it has very good cameras in it now. We can get good pictures of the eye. And so, for example, instead of having to go in for your contact lens check, it might be that you just image your eyes and the optometrist can see that and check that automatically, or even artificial intelligence can check and see whether there are any problems where you might need to go back into the practice. So as a researcher in this space, these are the sorts of technologies that I'm working on to make sure that we give our patients the best possible treatment, most efficient treatment, and particularly in the new environment that we live in with lots of digital devices, that actually the eyes can still develop normally and make the most of the information that's available to us.
Thank you very much. Abdul, how long have I left, by the way?
It's 3 minutes and another 10.
Okay. So, like you've heard, artificial intelligence is taking over the world and slowly in the UK as well. So, what's your views on it? And will there be anything out there for people to have better eyesight, or people with a disability, like myself with RP, tunnel vision, to get anything done?
So artificial intelligence is already being used in eye care, whether that's in helping us to better take in the information and translate that into the best possible treatment for an individual. We use it for training eye care practitioners. So actually AI can simulate a patient. And so they have opportunities to practice their discussion with the patient to get the optimum information out. For people with visual impairment, it's possible that AI in the future will help to understand their condition better and change things in the visual world, particularly with digital devices. Now we can move content in your vision to different positions in your visual field. So it may be that artificial intelligence in the future can do that in a quick and adaptive way, so people can navigate in the real world better. But I think particularly important is stopping that damage from ever happening. So with your smartphone, being able to take a picture of your eye, we're already using artificial intelligence to understand the length of your eye from that. In future, it may be possible that just by looking into a camera on your phone, we'll be able to learn all sorts of things about your eyes and to pick up any eye disease very quickly, so it can be managed appropriately. So yes, certainly an exciting time for technology that can help us in terms of making the best of people's individual vision.
I think that's all.
Yeah, so last question. How can people get in touch with you via email, phone, or like that?
So if people have inquiries about their eyes, probably the best place to go is to the College of Optometrists. So they have a website where you can pick up various features of your eyes. There's also a Dry Eye Association, so dryeyeassociation.com with hyphens in between the words. That will tell them a lot about their dry eyes if they're interested.
And are you guys on social media, or if anyone wants to email yourself, how can they do that?
It's best that they go through something like the College of Optometrists.
Okay, and do they have a social media?
The College of Optometrists will have social media, yet you'll be able to find that on their website.
Okay, and I'm sure they don't have a mobile number, you just email, is that correct?
Yes, that would be best.
No, thank you. So now, if you can just say your name and your organization.
So my name is Professor James Wolffsohn, and I am the Dean of Optometry at Aston University in Birmingham in the UK.
And just one more question. You said you're a professor. How did you manage to do that? And just tell us about your degree. It's amazing to become a professor.
So I did an optometry degree at the University of Manchester in the early 1990s. I then did some professional training at Moorfields Eye Hospital in London. Then I did a PhD in Cardiff, Cardiff University. And then after that, I went out to Australia and worked in Australia for 3 years. And then I came back to the UK in the year 2000, and I've worked in Birmingham ever since. And I've worked my way up the university ranks to being a professor from 2007.